Did you know your liver is your hardest working organ? That's why you need a healthy liver. Hepatitis, for example, is a serious liver disease that can kill you if you don't treat it in time. Get a liver test today. Your liver needs your love too.
Hello everybody, Assalamu alaikum. I hope आप लोग सब मज़े में होंगे. I hope you guys are doing well and safe as well. पिछली वीडियो में हमने बात की थी कि how these are unusual times. We are going through a very rough patch, but remember हमें hopeful रहना है. Hope can turn into a very powerful source, can turn into a very powerful force actually. And it can reassure us and it will probably get through us to the day. तो शुरू करते हैं. दिस इज़ योर होस्ट फॉर टुडे. मेरा नाम वानिया उस्मानी है एंड आई एम फ्रॉम टीम पाकिस्तान वेलफेयर ऑर्गेनाइजेशन ऑस्ट्रेलिया and in association with Hepatitis Victoria Liver Well, we are here presenting you the third episode of our very enlightening and informative session on liver health and hepatitis prevention. So welcome everybody. ये हमारा थर्ड एपिसोड है एंड पिछले एपिसोड अगर आप लोगों ने मिस किए हैं देन डू चेक देम आउट. उसमें हमारे गेस्ट ने डिस्कस किया था कि लिवर हेपेटाइटिस होता क्या है, व्हाट आर द टाइप्स ऑफ हेपेटाइटिस. हमारे दो गेस्ट आए थे एंड वी विल बी वेलकमिंग देम टुडे अगेन एज वेल. Hepatitis, the main purpose behind these sessions and these episodes are basically to provide awareness on hepatitis and liver health. And हम आपको वो information, vital information provide करना चाहते हैं जिसमें हमारी liver health involved है और हम कैसे अपने liver का ख्याल रख सकते हैं. So this third episode is all going to be on hepatitis B. पिछले दफ़ा हमने hepatitis C को cover किया था. This time we are doing hepatitis B. And for that, I would love to, and I'll be honored to invite one of our very special guests. She plays a vital part in Hepatitis Victoria, where she works as a health promotion officer and a active community participation coordinator, where she develops, implements programs and health strategies and bring health literacy and resilience among communities. So let's welcome Neelan Ayakot on board, everybody. Hello, Neelan. How are you today?
Hi, for having joined.
Thank you so much for joining us today, Neelan. So, starting off, you have shared fair amount of experience in working with some very interesting projects revolving around hepatitis B. Perhaps you can share some of these with us today.
Yeah, sure. I mean, so with Hepatitis Victoria now, I work mostly on hepatitis C and hepatitis B. But before I came to join this team, I worked in Tasmania on a really interesting project linking health services and migrant support services together because there wasn't really any linkage with those programs yet in Tasmania. So that was a statewide service that was a really great project to work on. And then coming over here, I guess one of the more unusual programs I got to work on was a program delivering health education to specifically to Aboriginal people in prisons actually in Victoria. So that was also a really interesting project that I've got to be involved with, interacting with different community members. Yeah.
Okay. Basically, this session is all going to be about hepatitis B. So hepatitis B को जानने के लिए, I would also like to welcome back again our another guest who is liver health ambassador for Pakistani community. Her name is Dr. Dhanak, and a little bit about Dr. Dhanak. She has a fair share of experience in medical as well. She is a medical doctor and had worked in the Department of Obstetrics and Medicine. So let's welcome her on board. Hello, Dr. Dhanak.
Hello and assalamu alaikum to all the viewers.
Wa alaikum assalam. How are you, Dr. Dhanak, today? Thank you so much for joining us.
Alhamdulillah, I'm good. Thank you for having me.
So, Dr. Dhanak, can you tell us what kind of experiences you had revolving around hepatitis B from your work?
Yeah, sure. I've had a fair share of experience. In fact, I have come across 4 kinds of patients. The first one are those who've come in for very common illnesses, and by luck somehow they got tested for the the hepatitis, and it came out to be positive. The second type is the one where patients have developed signs and symptoms, like for instance nausea, jaundice, pale stools, dark urine. Then the workup was done for the jaundice, that either it's obstructive, non-obstructive, and in detail, when they went, they discovered that, oh, the patient is actually it has been infected with hepatitis B. That's the second case. And then comes the third type. So the third type I encountered was the patient had actually developed complications. Hepatic tension, hypertension was there. Then hematemesis, that is खून की उल्टियां मिलना, black stools, things like that. And what was happening was that patient was misdiagnosed as acid peptic disease. They were taking proton pump inhibitors continuously on हमारी जबान में कहते हैं राइजिक पे राइजिक खाए जा रहे हैं घर के अंदर, अपना इलाज कर रहे हैं या मिसडायग्नोस हो गए. फिर एंड में जब कॉम्प्लिकेशंस के साथ आते हैं उस वक्त पता लगता है कि हेपेटाइटिस बी ने अपना मतलब काफी ज्यादा असर दिखा दिया है, क्योंकि ये डिजीज सिम्टमलेस रहती है. तकरीबन 80% जब नुकसान हो चुका होता है उसके बाद ये अपना असर दिखाना शुरू करती है. अच्छा, आखिरी टाइप जो मैंने देखी थी, the last one, which was that the patient was diagnosed and the patient had presented with complications only for the palliative care, because what happens in the end is the cirrhosis has developed, the scarring is there, it cannot be reverted. So what all we can do is prevent the pain relief. We can alleviate such symptoms. For example, the patient is developing hepatic encephalopathy. The bowel movements are not happening. So we would give drugs for that. Besides that, the ascites is there, pleural effusion is there. So we would be, relieving the patient of the pressures developing in the stomach, in the around the lungs, taking out the fluid. So these are the types of patients I have come across in my.
Dr. Damak, आपने अभी बात की about all the clinical signs and symptoms. Can you tell our viewers a little bit about what hepatitis B actually is?
Yes, hepatitis is the word which itself is comprised of two parts. You see the word hepata is a Greek which means liver. The second being itis, which means inflammation. So it means inflammation of the liver. Now, inflammation of the liver, that is jigar ki sozish. It can be caused by various things. Viruses are one of them. Viruses again are named the one after the inflammation of the liver, the word hepatitis itself. Like the 5 types are A, B, C, D, and E. Besides the Epstein-Barr virus, then there's CMV, many are there. But over here, we will be focusing upon, the viral hepatitis. Besides that, the hepatitis was discovered by Dr. Bloomberg in 1965. 1965 जो बहुत ही मशहूर ईयर है हम लोगों के लिए, तो इसके लिए ने नोबेल प्राइज भी दिया गया था. And that's very briefly how I can tell hepatitis. Otherwise, it's a very vast field.
Yeah. So coming back to Nilan, would you like to add something in that as well?
Apologies. Yeah, just would like to add that hepatitis B is a really old virus. This has been around for a really long time. In fact, some people have done studies that have been able to show human movement across time based on hepatitis B. So yeah, this is a really old virus. It's adapted a lot along the way, and it's something that affects your liver, and it usually takes quite a long time to actually cause serious damage. So many people can have hepatitis B for a really long time without realizing, without feeling sick or noticing anything at all.
Also, Nilan, are there any factors which speed up the damage caused by the hepatitis B?
Yeah, there are. I think we're going to get a slide up to go through some of those factors, but so women actually produce a hormone that slows the damage of viral hepatitis down. So actually for men, viral hepatitis can cause damage more quickly. Also things like having a co-infection. So if you have hepatitis C as well as hepatitis B, If you, so I think just click that slide once more. So yeah, and if you've got, if your diet's not very good, or if you drink a lot of alcohol, stress, obviously genetic conditions, all of these things can play a part with how quickly the progression of hepatitis B can cause serious damage.
Oh, okay. So what about its transmission? Is it different from hepatitis C, hepatitis B in context to transmission?
Yeah, there's a few things about hepatitis B that is different from hepatitis C. One factor is it survives outside the body longer, so it's a little bit more infectious actually than hepatitis C, and so in addition to being transmitted potentially all the same ways that hepatitis C can be transmitted. On top of that, it can also be transmitted through sexual fluids, and also the most common way that hepatitis B is actually transmitted is through childbirth. So if a mother has hepatitis B and she doesn't realise, it's very likely that will be passed on to the child at birth. We do have really good screening programs now to make sure if a woman is pregnant and she's engaged in care that she will be checked, but and there's ways to stop that transmission happening. So if you have hepatitis B, that's not going to stop you being able to have healthy children. It's just something that you'll need to manage.
Oh, okay. So Dr. Dhanak, what about how people can protect themselves from hepatitis B infection?
Regarding that protection, the first and foremost thing and the easiest way, the most appropriate approach would be to get vaccinated. Some people are, afraid of getting vaccines. So I would suggest that it's not something to, be afraid of. The vaccination program is very easy. For instance, the month you get your first dose, consider it the 0 month. Then right after 4 weeks, you can have your another dose, and then about at 6 weeks, you can have your third dose. So there would be 3 steps in which you can get completely vaccinated. Besides, now there are different fields in which, schools of thought, which say, some say that they should be 2 to 3 months apart, or that's another thing. It depends on which location you are. You would be guided accordingly. Another thing I would like to add is, no sharing of any such item which can cause bleeding of you. For instance, sharps, needles. This includes, any kind of needle. Maybe it's a razor, it's a shaver, it's the most commonest clippers, जिसे हम nail cutter कहते हैं. उससे भी, you're just cutting your nails and it might bleed. If the person is unknowingly infected, he might, pass on the infection. Yeah. So I have mentioned this in our previous series as well, that just have your personal kits for such things. For men, have your personal shavers. Now, the blades are already inserted in the instrument. Previously, it used to be that you are replacing the blade. So the most commonly among men, they are even sharing those, shavers. So don't do that. Have your own. It's a personal thing. Your toothbrush is your personal thing. Have your own clippers. Have your own shavers. Same goes for the females as well. Have your own beauty kits. Have your own sponges. If you have some skin condition that can bleed, you're doing a makeup, your friend is sharing it. Maybe you don't know it. You don't have it. Your friend might get it, and she might transfer it back to you. So just be careful in these things.
Neelan, would you like something to add in that as well?
Yeah, so I'd just pick up on what Dhanak was saying about having your own personal equipment. This is really important, and if people know that they have chronic hepatitis B, then often they'll have their own sponge bag, and it's really important to make sure all of that is, kept out of reach from the children. This is often a family story, hepatitis B. So you can put some strategies in place, but also as Danak said, the best protection is obviously being vaccinated. So the vaccination is 3 injections over the 6-month period. And generally, best practice is, 0 day, 1 month later, and then the 6-month mark. And then ideally you would go back 1 month later and just get a blood test to just check that your system has accepted the vaccine, because occasionally some people vaccines don't work for, but then you'll know that you're protected for life. And it's actually an amazing vaccine, and they say it's the first cancer preventing vaccine that's ever been created, which is extraordinary.
Yeah. So we talked about vaccines. What if those people who don't know, who are not sure that they have been vaccinated or not? What should they do then?
Yeah, well, the blood tests that you get now to see if you have hepatitis B, they actually give you a lot of information. So that one blood test will show, because a lot of people don't remember if they've been vaccinated, or if they did start, maybe they don't remember if they finished the course, or so you can actually go, that one blood test will show you if you've been vaccinated and you're protected, if you've never been vaccinated and you should get vaccinated, if you have active hepatitis B, or if you have been exposed to hepatitis B, but your body has fought it off and you have become immune. So a healthy adult, if you're exposed to hepatitis B, can often fight it off and gain a natural immunity. Children are actually the most vulnerable to hepatitis B.
Okay. And Dr. Danak, how is it easy to get tested? How easy it is to get tested nowadays?
Sure, Wania. The first step would be to go to your general practitioner. Tell them your concerns, that you really want a healthy liver. Besides having a healthy heart, healthy stomach, healthy brain, liver is something you're concerned about too. So the step starts that the doctor would be taking your history. They would try to figure out if there is something that clicks. Then proceeding to it, there would be a physical examination. Doctor would be looking for specific signs and symptoms all during this time. Then there would be some blood tests that would be prescribed. And in that, it's anti-HCV and HBsAg. That is the antigen of the hepatitis B and the antibody for Hep C. So these tests combined would be done, and the results would show if you have ever been infected. And just like Ellen was saying, it would also show you if you have been vaccinated before. Because in that, it goes a little complicated, but I would keep it simple that it can show either you have been infected or not, or you have been vaccinated or not, that a doctor can tell. So start from there, and a baseline complete blood count would be done. So it's not a very complicated process.
It's a straight go process, yeah.
Yes, exactly.
Okay. So Neelan, what can we do if we have been diagnosed with chronic hepatitis? Is there a cure for it? Is there any management for it?
So there is really effective medications to help manage hepatitis B. Generally, what will happen if you have hepatitis B, they will ask you to remain in a monitoring cycle. So that would be once or twice a year, so every 6 months or every 12 months, to have a checkup and see how healthy your liver is, check on the viral load. If the viral load starts to pick up speed, that's when they would start to put you on the medication. And the medication stops the virus from being so active that it damages your liver. So that there is really good treatment available, but the main thing to be aware of is that you will start, once you do start the medication, you're on that medication for life. So that's a lifestyle that you will need to adapt to look after your hepatitis B condition.
Okay. So thank you so much, Neelan and Dr. Danak. Now we'll be playing a very short video on in this context, and do watch it out.
When I was born, a vaccine for hepatitis B was not yet available. The virus passed through my mother's blood, but it is not genetic. Hepatitis B became part of my life. It has been in my family for generations. It was like a family secret. My first real encounter with it is when my grandmother passed away from its consequences. Hepatitis B affects the liver and can lead to cirrhosis or liver cancer. Even if everyone around me had been vaccinated and was protected from hepatitis B, I felt that I could pass it to others. I grew up alone, isolating people from my life. When I got older, my liver was getting affected by the virus, so I started antiviral treatment. Doctors said I had to take a pill every day for the rest of my life to manage the infection and stay healthy. It was hard because taking daily treatment, I felt almost more lonely and ashamed. There, I met him. We were on the same boat. We both understood and helped each other. As most people who were taking hepatitis B treatment, I kept healthy and well. I decided to become a researcher. From there on, my search for a better future has not stopped. And now, after years and years of research, cures are on the horizon. Scientists are finding new drugs that could allow life without daily treatment, without the risk of transmission to another person, and hopefully without stigma. There are clinical trials enrolling now. There is more work to be done, but we are closer than ever before. We have to stay strong, get tested and treated today. It's important to control the virus and allow the liver to stay well, so we are in the best health possible when curative therapies are available. There is hope that we could live hepatitis-free in the future.
Thank you for sharing that video. That was made by the International Coalition to Eliminate Hepatitis B. And they're based at the Doherty Institute. It's really quite a moving video with a real message of hope about the research into finding a cure for hepatitis B. So this slide is this is very new information. Recently, the latest mapping report was launched just last week. So this is an analysis of all of the data across Australia and how many people are getting treatment for their hepatitis B. So it's very interesting to see. There is still a lot of people who don't know that they have hepatitis B. About 30% is the estimate of how many people are living with hepatitis B without knowing. And that actually it's quite concerning if you follow on from there. Only 22% of people who have hepatitis B are engaged in care, and of them, of the total, less than 10% of people with hepatitis B are actually engaged in treatment. So we really want more people to be getting tested and seeing if they have hepatitis B, but also if people have hepatitis B, we really want them to be engaging in care, and by engaging in that care, they'll know when they can start their treatment, because it really makes a difference of many years of healthy life. So it's very important.
It's very important, yeah. So thank you so much, Neelan and Dr. Dhanak, for taking out your time and joining us today. I hope to talk to you guys again soon for another last session of ours. Thank you so much for joining us.
Thank you.
Yeah, no worries. Thank you so much. So basically, as Neelan said, कि hepatitis B की transmission जो होती है वो different होती है hepatitis C से, because hepatitis B की transmission is all through body fluids, right? So हमें जानना इस बारे में बहुत ज़रूरी है that hepatitis B is dangerous than hepatitis C, और हमें इसके बारे में aware होना बहुत ज़रूरी है. Thing is, the motive behind all of our sessions is basically to provide you that information कि हमें कैसे पता चलेगा कि हम इस बीमारी में मुब्तला हैं, कौन से वो टेस्ट हैं, कौन से वो टेस्ट नहीं हैं, all of that. So if you have missed it, then do check out our previous videos. उसमें हमने hepatitis C के बारे में भी शेयर किया, hepatitis के बारे में भी हमने बात की. तो basically, what we can do now is that if we are unsure, then there are plenty of blood tests जो नीलन ने mention किए थे, हम वो करवा सकते हैं. And treatment is not complicated. Treatment is not complicated at all. As Dr. Dhananjay said, it's very straightforward and we can get treated. ये नहीं है कि hepatitis है तो वो treat नहीं हो सकता. It can get treated. जाते जाते एक बात मैं कोट शेयर करना चाहती हूँ. एक्चुअली आई वाज गोइंग थ्रू दिस वन इंटरव्यू विच वाज ऑफ डॉक्टर रोहित सतोस्कार. ही इज़ ए MD इन जॉर्ज टाउन ट्रांसप्लांट इंस्टीट्यूट. उन्होंने एक बात शेयर की थी कि लिवर एक ऐसा ऑर्गन है, लिवर इज़ दैट ऑर्गन दैट इट कैन बी ट्रैश्ड वेरी इजीली, एंड वंस यू ट्रैश इट इट्स गॉन फॉर एवर. तो आप उसी बात से अंदाज़ा लगा लें कि हमारा जो लिवर है इट्स सच अ वाइटल ऑर्गन, और वो इतने सारे रोल्स के लिए वो रिस्पॉन्सिबल है कि अगर खुदा ना खास्ता हमारे लिवर को कुछ हो गया, देन आवर बॉडी वोंट बी एबल टू सर्वाइव विदाउट इट. तो यहीं ख़त्म करते हैं. आई होप आप लोग को सेशन बहुत मज़े का लगा होगा. आई लर्नड अ लॉट एंड आई होप यू गाइस लर्नड इट टू. तो अपना ख्याल रखिएगा. एज आई सेड बिफोर, अपने लिवर का ख्याल रखिएगा, एंड स्टे होम, स्टे सेफ. Talk to you soon. Allah Hafiz.
Did you know your liver is your hardest working organ? That's why you need a healthy liver. Hepatitis, for example, is a serious liver disease that can kill you if you don't treat it in time. Get a liver test today. Your liver needs your love too.